We often talk here about the importance of proactive funding into our neighborhoods to hopefully provide more opportunities, more funding, more infrastructure, more opportunities for people that might resort to crime who are impacted by all kinds of impediments and challenges in their life. We always talk about how so many of the homeless people we see out on the street were probably pushed out of mental health clinics. We also talk about how many people that could really benefit from mental health are engaging in crimes out of desperation. So quite naturally, the push to reopen our shuttered mental health clinics are challenged by the city's top doctor. This comes to us from Aaron Haggerty at the Daily Line and Alex Nitkin at the Daily Line, as reported by Block Club Chicago. Get ready to get pissed off. Mayor Lori Lightfoot's administration is pushing back hard on a proposal from the city council to reshuffle mental health spending to reopen city-backed clinics, saying the plan could veer the city off its existing path to widening psychiatric outreach. How? Mayor Lightfoot just proposed in her last budget address, she's getting all this federal bailout money, and she was going to create a $500 monthly stipend for families that qualified through means testing. But what? There's not enough money there to reopen our mental health clinics? But there's plenty of money to what? Everybody in the live chat? Increase the police budget, fund the police, right? Never a question there. Mental health clinics, not so much. God damn it. The ordinance 02021-4773, authored by Alderman Rosanna Rodriguez Sanchez of the 33rd, is one of 8 proposed amendments progressive aldermen and community groups submitted to the city's 2022 budget last week in separate attempts to tweak Lightfoot's $16.7 billion spending plan. Other measures would boost funding for lead pipe replacement, sorely needed, violence prevention, and other initiatives above and beyond the allocations Lightfoot rolled out as part of her Chicago Recovery Plan last month. Rodriguez Sanchez's measure, which would seize $10 million of the $151 million earmarked to the Chicago Department of Public Health from the Federal American Rescue Plan for spending on mental health clinics, is the only proposal of the bunch that has scored support from a majority of the city council. As of Monday, it listed 25 co-sponsors. The $1.9 billion federal windfall coming to Chicago presents an incredible opportunity for us to fulfill the promise that Lightfoot and multiple aldermen made during their 2019 campaigns to reopen the 6 public mental health clinics that former Mayor Rahm Fuckface Emanuel closed in 2012, Rodriguez told the Daily Line on Monday. We have a crisis of mental health in this city, and the public mental health clinics are a fundamental piece of making sure we are providing it, she said. We've not set up those public clinics for success. But city health officials say her plan would throw a wrench into Lightfoot's ongoing effort to expand mental health services by other means. How? What, does she have an alternate plan that's not already there, that other people are going to benefit from this federal bailout windfall? I'm just asking. Health Department Commissioner Allison Arwady sent a 2-page letter to aldermen on Friday urging them to reject Rodriguez Sanchez's concerning, quote-unquote concerning proposal to reopen those mental health clinics, saying it would sap resources from the trauma-informed centers of care network the city is weaving together with funding from various sources. Okay, so let's they don't have the trauma-informed centers of care network in place. They're weaving it together. Meanwhile, they have closed down mental health clinics that could reopen. And the mayor's against that because we got to throw the money into weaving together the funding from various sources for that other care network that's not in place. The Centers of Care model has already expanded to serve 26,000 Chicagoans during the first half of this year, up from 3,600 in all of 2019, Arwady wrote. This is many more clients with a wider range of needs than the city of Chicago has served in decades, if not ever, and we're still expanding, the commissioner wrote, adding that the mayor's 22 mental health budget plan would more than double the city's overall mental health spending to $86 million. I have an idea. Can we take $10 million away that city council is asking for from more police overtime and more police budget funding and just put it in the fucking mental health clinics so that they can have both? What's wrong with that? Is it really going to make that much of a difference if you just reopen the clinics while you're weaving this plan together that's not completely in place? Do the police really need all the police department that we're seeing all these cops who don't want to follow the public health mandate to serve are being disciplined because they feel that the law doesn't apply to them when it comes to their jobs? Um, we're in the twilight zone, everybody. But the city should be expanding its mental health outreach by investing directly in city-run clinics, not in outside organizations, which are harder to track and regulate, Rodriguez Sanchez argued. Exactly. Publicly funded nonprofits typically pay clinicians less and employ non-union staff with higher rates of turnover, threatening the clinic's abilities to build long-term relationships with clients, she said. We can't just decide this is the cheapest way to address the trauma of the city when we actually are getting the funding to build up a public mental health system that can be accountable to the people of Chicago, Rodriguez Sanchez said. We're seeing government run like a business, and that's the problem. Because remember, people, government's not supposed to turn a profit. And whenever you hear these assholes talking about we need to run government like a business, yeah, business so that their cohorts can take the funding from these programs and enrich themselves, not actually put it into the programs that are being shut down and privatized by our city officials. Government's not a business, it's a lifeline. People need these services, and we can't cut corners. Alderman sparred with Arwady in 2019 over reopening the city's mental health clinics, hobbling her confirmation as she defended the 2012 closures. Health department officials are set to brief Alderman Tuesday on Lightfoot's mental health plan in advance of Friday, when the Committee on Budget and Government Operations is due to take up Lightfoot's budget appropriation and management ordinances. Lightfoot's response. Ready, guys? Lightfoot said during a news conference Monday that she has not yet had time to digest, quote unquote, digest. It's because she's too busy on social media making bets with people in other cities about our sports teams. The proposed budget amendments, but as always, we work in good faith with the members of City Council to see where we can reach some common ground if possible. The mayor said her office has begun reaching out to sponsors of the proposed amendments and where we can reach some common ground as well. Still, the most important thing is we got to move forward, Lightfoot said. We've got a lot of people across the city that have significant needs that we've got to meet now and in the future. Actually, Mayor Lightfoot, we've got to meet yesterday. Yesterday. You've abandoned these people with this political kabuki theater bullshit. Advocates for the budget amendments gave a hat tip to Lightfoot's budget for meeting some of their demands, but don't think the spending plan goes far enough. We recognize that the mayor's budget proposal this year is as close as we've seen from this administration to the community's demands of the work we've done since 2019 and most recently around the American Rescue Plan funding, Kennedy Bartley, legislative director for United Working Families, told the Daily on Monday. Still, some communities are being left out, and advocates introduced the budget amendments to meet the needs of folks we've talked to on the ground in our communities, Bartley said. Jumping ahead, cutting police vacancies, spending on CPD advertising. Separately, a proposed budget amendment from Alderman Maria Hadden of the 49th would cut out of next year's police department budget about 300 vacant sworn officer positions that Police Superintendent David Brown said the department will not be able to fill next year, representing $44 million in savings. We're looking at what's the margin of sworn officer vacancies we cannot fill in 2022, and can we zero them out? Hadden told the Daily Line on Monday. Can we take away from the money we're planning for the positions that cannot be filled and use it for something else? Why not? Hadden said there's no reason between $40 million and $50 million should be just sitting there if the police department cannot fill the positions. Another budget amendment proposed by Rodriguez Sanchez and Alderman Byron Sigjo Lopez would hold the police department's spending on advertising at $24,000 instead of the department's proposal to balloon the line item to $230,000 is what the police department wants to promote advertising for CPD. I didn't know that the police needed an advertising budget. Marketing campaign. Ooh. While Hadden's proposed amendment is not tied to any specific spending proposal and discussion is ongoing, she said the money could help bolster funding for non-police public safety measures or prop up efforts to preserve Chicago's existing stock of single-room occupancy buildings. That's the other thing we're missing out on is the SROs. Hadden said her proposal to direct $70 million to preserve existing SRO buildings would help the city address the demand for affordable housing. The affordable housing crisis we're in right now, a lot of our SRO buildings are of a certain age, and not preserving them will only displace more people and lead to homelessness for more residents, Hadden said, adding that preserving existing buildings is usually more cost-effective than building new. Lightfoot's Chicago Recovery Plan sets aside $35 million to add new units of supportive housing and rehab buildings, and $30 million for non-congregate housing programs that would allow the city to expand its use of former hotels for permanent supportive housing. The initiative is designed to help Chicago residents who do not have permanent living situations. Anyway, everybody, look, long article, very, very well covered by Block Club Chicago, reporting for the Daily Line, linked in the show notes below. I would encourage you to go down there and read the article in full.